Well, apologies to those watching online for the interruption. You haven't missed anything. We've been pausing while we sorted out the problems. So we're going to go back to the beginning of item 5, which was to do with the Lincolnshire Adult Safeguarding Board. And I'd like to welcome Heather Roach, Chair of the Board, and Justin Hackney to give the presentation today. I think we're going to go to Heather first.
Thank you, Chair. Simon, are we going to try to share the screen again or not?
Yeah, we're just opening the presentation now, Heather. I think since we're having problems with getting the presentation up, something's happening. Perhaps, Heather, if you'd like to start, we can always forward these slides on afterwards to members of the committee. Thank you.
Yeah, no, that's fine. Thank you. Good morning, everybody. The update that between Justin and myself will give covers about 5 areas of the board. Thought it might be useful for you to know how we've managed the board through the COVID pandemic. I'm going to pick up on the strategy. I'm going to talk about our assurance process, team around the adult programme, and then a little bit around the safeguarding data for this year. So just picking up on the pandemic, initially for the board, I took over in April last year. Some staff were seconded to the Resilience Forum, but we really needed to keep a focus on safeguarding, as there were clearly some potential significant issues around the national lockdown. So we instigated a fortnightly COVID executive meeting and included ULHT in that. I had a weekly catch up with Justin on how things were. I also pulled in additional meetings with Lincolnshire, which is our care association, local prisons and probation, and various other organisations to just get a feel for how things were and keeping the focus around safeguarding. The risks and issues we identified, we put together into a risk register, and we joined together with the Lincolnshire Safeguarding Children's Partnership and also Safer Lincolnshire Partnership. And we fed that into the Resilience Forum on a regular basis. It was very much a two-way conversation with them, and also if we had any particular issues we need to ask and gain assurance about, we had a really good routine and a good relationship with the LRF. We've continued throughout with our quarterly executive meetings and also partnership meetings. So essentially business as usual, but for a period of time somewhat, I guess, proportionate really to allow organisations to deal with what they have to deal with. So that's the COVID part. I was going to mention the 3-year strategy. It was due to come to a conclusion in 2021 in March, but what we decided to do, because we had to pause some areas, was to roll the strategy over for this next year. we've agreed to continue with the same objectives, and we have updated the strategy, which I'm quite happy to obviously share with you. It is published. We've also then collaborated with the Children's Partnership, Domestic Abuse and Safer Lincolnshire Partnership to look across the 4 boards and do a strategic needs assessment, which is therefore looking at priorities that we can share going forward next year. We've also working closer with those boards. We're developing a MOU, and we're also looking at the communications across 4 boards, training, and also our audit facilities. So we're working very closely with them. The sort of timeline for the strategic needs assessment, which will help us develop our next strategy, is that should be completed. Well, it's almost completed now, so we will be discussing it in August, September. I'll run a development session with the board towards the end of the year, and we'll be looking towards a new 3-year strategy going forward in April next year. So that's picking up on the strategy. The assurance process, the key role of a safeguarding board is to assure itself that safeguarding arrangements across our partners are effective. We know that services have had to change and develop through the pandemic, and there's obviously been some benefits to that, but also, you know, where there are inequalities within our community, they can be exacerbated. We have what we call an assurance framework, which is very similar to what the children's side of business do, which is a Section 11, but we don't do any moderation around that at the moment. So what I've introduced to strengthen it is assurance and development sessions, which are half days. And the first one is very much focusing sort of post-COVID. We've set our agencies a number of questions to be backed up by data. We're looking at areas of good practice. We're looking where there might be some gaps in services. Aha! Can you move on to about the third one, Simon? Yeah, there we go. And looking at the sort of challenges and our future priorities. So that again will feed into our strategy. So our first assurance and development session is September, and then for our partnership board in November. Okay, next slide. Okay, I'm going to ask Justin to come in here because this is very much a project that Justin's been very much engaged with his team around the adult. I say we did slightly delay the start of it due to COVID, but it is now well and truly up and running. Justin, did you want to give a quick update on that area?
Yeah, that's fine. So for those people who don't know me, I'm Justin Hackney. I'm one of the assistant directors in adult care, and I lead on. Can everyone hear me okay, or is there? Yeah. Yeah, sure. Is that better? Okay. So yeah, I'm Justin Hackney. I'm one of the assistant directors in adult care and wellbeing, and I lead on adult safeguarding, as well as commissioning services for adults with mental health, learning disability and autism. So I'm very pleased to meet those councillors who I've not met before, and to say hello again to those that do know me. So in terms of team around the adult, it is a prevention initiative, and it was born out of a serious adult review where there are a number of adults in the Grantham area that were either victims of abuse or neglect and or perpetrators of abuse and neglect. These people had a number of complex needs, including mental health problems, drug and alcohol addiction, and some homelessness issues as well. And the core theme really was that people were falling between the gaps, and also there was a level of disengagement with services as well. There were a number of key recommendations that come out of the Serious Adult Review. One of them was to do a review of multi-agency safeguarding meetings operating at a locality level. And the other was to look at preventative approaches in terms of helping people to engage in services that would help them keep safe going forward. So working with district councils in particular, and with other system organisations, for example, LPFT, our Mental Health Trust, and other health providers as well. We developed this team around the Adult Initiative, and it builds on the back of the vulnerable adult panels that the district councils operate currently. And what it does is where partners are struggling being able to come up with solutions to get people to get engaged and to help them through their problems, then they can escalate it up to the coordinators. We'll then hold through, supported by LSAB policies, hold strategy meetings, and we'll look at ways in terms of best engaging with those adults. So it could be a professional, it could be someone who knows the individual very well, but whoever is best placed to actually get that engagement and encourage them to take up services. So the initiative started in February, and I mean, it would be good at some point if we could bring some case studies to you as a committee to show you some of the results that are coming out of there, but some really encouraging findings in terms of success in getting people who normally disengage with services to engage with services, and getting much better outcomes for that, really. And then just finally, really, what we're looking at, the team around the Adult Initiative is going to be reviewed by Lincolnshire University probably later this year in terms of impact. But we are already having discussions with the Safer Lincolnshire Partnership and with Heather around next steps for it, really, in terms of being able to build on what we've achieved so far, to look at it being a system-wide prevention and early intervention measure. I'll pause there.
Thank you,
Thanks,
Justin. Did Heather want to say any more before we ask for any questions?
I think, Chair, just moving on slightly, I've got one or two more slides. I think Justin's absolutely hit the nail on the head. One of the biggest things that we're hearing at the moment is just the sheer complexity of cases. The data that we've just supplied to you is this year's data. It's very top line, but shows that we've had, local authority have had a 17% increase in concerns being reported to them over the last year. There has been a national project, LGA Insight project, which has looked at data across the UK, and we've mirrored that. At the beginning of the pandemic, the reporting went down quite significantly and then has come back up and overtaken last year's numbers of referrals. So we are looking behind the numbers on this. The top concerns, if you just flick onto the next one, Simon, it again mirrors other areas around the country. So the top areas are neglect, financial abuse and physical abuse. At the moment, we're doing some work around the financial abuse, currently looking at what that entails, and that is different to fraud and scams. That is very much where somebody potentially, as you'll see, within their own home is being financially abused by either a family member or somebody providing service. So we're having a deeper dive look at that at the moment. Just to pick up 2 points, learning from safeguarding adult reviews. As Justin has said, Team Around the Adult came out of one of our reviews. We're holding a virtual event on the 12th of October to look at key learning from our SARS and from national SARS, and that's aimed at frontline practitioners. So we're doing a very short 1.5 hour virtual input to frontline staff around that learning. And then the final thing really is we are required to publish an annual report, which I'll be working on over the summer, which reflects back on the previous 12 months. So that's the update from our board. So available for questions.
Thank you, Heather. Thank you, Justin. Does anyone have any questions? Councillor, Mr. Clark.
Thank you. I've got a couple of thoughts that passed through my mind when I read the report. When you were doing your fortnightly and monthly reviews on the COVID process, do you think you had that timing correct? And if a similar event happened in the future, would you follow the same pattern?
Thank you. Yes, it's a difficult one to gauge. I think the timing was reflective of how busy agencies were, but actually getting some time out with them to speak about their experience and what they were seeing and where there were any issues. I think because I had very much a weekly meeting with Justin, it was very easy for me to touch base and understand how it was affecting services. So I think it was about right. I mean, if you went, I think children's did weekly meetings, different issues for how COVID and the lockdown affects children and education, obviously. But I think it was about right. I think you just have to look at it at the time and decide whether that is the most appropriate frequency for your meetings.
Okay, and I've got another question. Did I hear you right that you're reviewing your strategy this September?
We are doing a joint strategic needs assessment with the other 3 boards initially to look at whether we can do any, whether there are cross-cutting themes that we can take some priorities from, so that we can work together on them. But by sort of the end of this year, we will be developing our strategy going forward for April next year.
Okay, thank you for that. And there was an abbreviation used which I'm not familiar with. MOU?
Sorry. Yes, a memorandum of understanding. It's literally agreement between the boards as to how we'll work together.
Okay, thank you for that.
Thank you, Councillor Clark. I think Councillor Kendrick had a question.
Thank you, Chairman. I was just wondering, do you do any benchmarking against peer authorities, or are we again leading the field as we do in so many things in this council? As obviously ideas can be shared and learning between authorities. I was just wondering how much might be done in that area. Thanks, Chairman.
Yeah, we have a audit and policy officer, and as part of our audit, we do look at other areas. I haven't over the last 12 months done any benchmarking. I am part of the regional chairs network and also sit on the national executive now. So it is an area for us within our quality assurance to take forward. But you can be rest assured I am constantly looking at other boards and other areas to see how we're performing. But we do get obviously national data as well on the return every year.
Thank you. Councillor Carter's next.
Sorry, I just had another thought regarding your stats.
Councillor Carter next, please.
Thank you, Chairman. My question is around the team around the adult on page 7 of the report. It talks about the team around the adult being a key element of the board's prevention and early intervention strategy, but then later says that the subgroup is set up in relation to prevention and early intervention. So just kind of really wondering what actually that subgroup's going to be doing. So obviously there's not duplication, and just a little bit more information about that subgroup, please. Thank you.
Okay, I'll take that one if that's okay. So yes, I probably should have mentioned that the board has developed a prevention and early intervention strategy, and the team around the adult initiative is one of the priority delivery objectives within that. So the subgroup that we've set up as part of LSAB will look at the oversight and implementation of all of those priorities, including team around the adult. And that's effectively an annual plan really in terms of those objectives. And again, when we look at refreshing the overall LSAB strategy, we'll also look at refreshing the prevention objectives for the following 12 months as well. But it has very much got that early intervention and prevention focus, often for matters that won't reach the thresholds for a safeguarding inquiry.
Thank you. It's Councillor Lee.
Thank you, Chair. We're already facing another COVID surge. I watch Look North at 10:30 every evening, and the numbers have been going up for some weeks now. And the number of hospitalised cases, despite what you read, are going up too as well. I can tell you that for a fact, because we get those coming round several times a week by email to let the staff know the numbers that have been hospitalised. So I've got 2 questions, bearing in mind that we are probably facing a further surge. My first question, can you tell me specifically what kind of safeguarding issues arose due to COVID? You said that some had arisen that were specifically due to COVID. That's my first question, because obviously we need to prepare for that when we get the next wave. And then the second question, I'd like to know, how has COVID specifically affected those who are at particular disadvantage? Because you mentioned that too. Again, awareness and preparation for the next wave. Thank you.
Thank you. I think we could probably do a joint answer between myself and Justin on this. So specifically the risks and issues that we identify, we put into a risk register. So things like, the first one that comes to mind is there was a government directive around the easement of assessments for people within that needed care and support. It was something that the local authority could have invoked if they needed to, but didn't within Lincolnshire. So that was a particular area that we monitored. Things such as vulnerability and isolation of individuals and their susceptibility to crime. So that was another area. The capacity of our services to manage and to be able to keep safeguarding at the forefront of what they were of their considerations. So we had a risk register which picked out a number of these areas. And when you talk about the disadvantage and inequalities within society, one of the particular areas, I suppose, is around the sort of technology and digital era. Most of us can quite happily go online, can book appointments to talk to your GP or get into the health system, but there is a generation and people who can't do that for one thing or another, and it's just making sure that services are alive to that problem and consider that when they change the way that they deal with their service. So not having face-to-face meetings, etc. So how do you then go around being able to do that? So Justin, do you want to add anything to that?
Could you put your microphone on, Councillor?
Sorry, I forgot that. The numbers are there, the cases are rising and the hospitalisations are rising. Are you literally ready to go? I'm sure you are, but I'm just asking the question.
Yeah, I mean, to be fair, where our perspective is about keeping people who need care and support, keeping them safe and making sure that that is at the forefront of agencies' service really. Ours is not to deal with the response to COVID. It's slightly different to that. So if we have to go into another lockdown, if we have to re-engage as an executive to look at what the issues are, definitely ready to go.
Yeah, I'm thinking in terms of staff, because obviously staff get hit by COVID, don't they, if and when we have another wave. So I'm just thinking in that respect, you're well, as ready as you can be, I guess.
Absolutely. I think it's, we have very much asked our partners how their resourcing is, what their capacity is, and obviously the knock-on effect of COVID is things like increasing mental health problems. That is probably one of the biggest issues that they've experienced is the knock-on effect, not the actual dealing with the pandemic.
Did you want me to come
Sorry, Justin. Yeah.
Briefly there, Heather? So as Heather said, really, the LSAB's role is around assurance, as well as the LSAB operating during COVID. We've obviously had the Lincolnshire Resilience Forum, which has been really coordinating much of the response to COVID. And I was part of the membership of the LRF as well as being part of the membership of LSAB. So that's why I met with regularly with Heather and was able to provide that reassurance around, what we were sort of managing through the LRF processes really. But it was really helpful from LSAB perspective, be able to really drill down into a lot of the safeguarding issues. So quite, we were already managing many of those issues in response through the LRF. So, for example, workforce was a key issue. Would we have enough operating capacity across, the residential sector, across adult social care, assessment and care management functions to continue to provide our statutory responsibilities. So we were able to drill down with Heather and provide the LSAB through the assurances around those, really. So in terms of responding to another wave of COVID, the LRF is currently in recovery phase at the moment, but should we need to, then it would flip back into response, and then all agencies would be mobilised in terms of that, doing that again, really.
Yes, thank you. Justin. Glenn, did you want to add to that?
Thank you, Chair. I think it's important to note that the impact of COVID in the general population has probably had more effect on exaggerating existing trends that preempts COVID rather than introducing new ones. If we think about the prevalence of loneliness, which also is directly affecting mental health and well-being, if we think about domestic abuse, which was already on the rise, suicides, which were already on the rise, and also inequalities, those existed prior to COVID. And the earliest data we have, because it is very early to get national and regional data on this, suggests anecdotally that those preemptive rises have been exaggerated. No one organisation is going to be able to deal with all of that, all those manifestations in the community. That's a collective endeavour, and that's one of the reasons why the integrated care system in Lincolnshire is so important as we move forward. I think it's also worth noting, Chair, that the government austerity measures that started from 2008-2009 have had a direct effect on lifespan and on health and well-being. There's some very good evidence that was recently published in The Lancet that gives voice to that. So we have previous, as it were, societal changes that COVID has exaggerated, and we have government funding to local governments, which has clearly impacted not only on longevity, but long-term conditions as well.
Yes, thank you, Glenn. I think Councillor Young, you
Can
were
I
next.
just wanted to come back and just say the lady's words about mental health, and particularly about digital disadvantage. I so hear them. I help look after my mum, and to be honest with you, I don't like doing a lot of things online, but how elderly people must feel. It is a huge, huge disadvantage, and just about everything. You can't even get to your doctor now, can you? You've got to go for an online appointment. I think it's really difficult. And just the bit about in recovery phase, honestly, in the NHS, we're exhausted. The doctors are going downhill now, and how we'll cope with the next wave, I just don't know, but that's a different thing.
Yes, thank you, Councillor Lee. I think we all agree about the technology, especially this morning. Councillor Young.
Thanks, Chair. Justin, vulnerable adult panels. My experience...
Sorry, Councillor, could you speak into your microphone?
Sorry.
They won't hear you online.
Yeah. My experience across the county is that some are more established than others. Are they now all established? And is it fully embedded? When they work well, and some districts have been far more advanced on this than others. East Lindsey in particular have had a vulnerable adults panel for at least 10 years. It works extremely well. But I just get a feeling in terms of some districts, there's still a long way to go. Certainly around the pathways and processes, and not just for professionals, but for lay people as well, in terms of how do you refer into a vulnerable adults panel. And I'd be interested to know that.
Okay, thank you. You're absolutely right, Councillor Young. Yeah, they are at different stages of evolution, if you like. They may not all be called vulnerable adult panels either. They may have different names in that locality, but the commonality is around a group of colleagues from different organisations coming round for, you know, the mutual sort of benefit of vulnerable adults. So one of the things that we are continuing to do is work with each of the district councils in terms of trying to, as much as possible, get those arrangements more standardised, and in terms of operating procedures that link to the referral pathways in as well. So yeah, there's still work to do there, and I think that's including sort of leadership of those local arrangements as well.
Thank you, Justin. Councillor Mrs Clark, I think you have a question.
Yes, just a small question from me around assurance processes. I don't doubt that in the future with the strategies we'll get sight of them, but I want to ask you, will we be getting sight of the data that you'll be looking at specifically around good
Sorry,
practice?
Councillor, you're not speaking into your microphone.
Sorry.
They won't hear online, and it must be so frustrating for them.
It is, yeah. My apologies. I'm reading at the same time as asking the question. Yes, regarding the assurance processes, I don't doubt that we will be seeing the future strategies as they go forward, but will we have sight of the areas of concern for future focus and the operational assurance event, the areas of good practice? We need to see what good practice looks like. Will we be getting that, please?
Yeah, I think, Chair, definitely. I think that's a really great idea going forward. You certainly, we require to publish our annual report, we're required to publish our strategy, but I'm more than happy to share that with you before we're ready to publish, and to just talk it through with you. And also, you know, basically it's about showing you the workings out behind that strategy, how we've got there. And once we've seen the needs assessment across the 4 boards, I think that'll be really interesting to see where we can work jointly. But yes, I'll definitely do both of those.
Thank you, Councillor. I think, Councillor Mr Clark, you had a follow-up question earlier.
Yes, thank you very much. We've heard from you the way you're going forward, but one of the things I'm lacking is, could you give us an idea of actual numbers that we're dealing with? Percentages are fine, but could we have an idea of the numbers that we're actually dealing with these issues? Thank you.
Heather, would you like me to take that?
Yeah, please, Justin. Yeah.
Okay. So one of the slides earlier, in terms of the safeguarding data, for the last financial year, there were actually 4,272 safeguarding concerns raised. Now, not all of the safeguarding concerns actually meet the eligibility criteria for what's called a Section 42 inquiry. So that's where we have to look into whether there has been abuse or neglect, and if so, see what we can do to remove that risk from it. So of those 4,272, there were actually 1,681 of those that made it through to a safeguarding inquiry. So effectively, they were previously known as investigations, but there'll be a process where we look into those issues to protect the individual at risk.
Thank you for that.
Yes, thank you very much. I'm conscious of the time, so has everyone asked what they needed to ask? And basically, on this item of the agenda, we're to note and consider the information that's been presented, and to consider the timing of future reports. And we're suggesting every 6 months. And I think because of the interest that we've shown today and all that's been said regarding the COVID and everything that's going on, I think that's probably a good idea. So is everybody happy that this comes back in 6 months? Yeah. Everybody happy? That's great. I think just to summarise what everybody's said, it's clear that this COVID is casting a long shadow over so many people's lives. Not least of which through the mental health issues and other issues that have been talked about today. The team around the adult initiative, I think we're all very interested in that. It's early days, as Justin said, but hopefully when you report back in 6 months, we'll have some more information on that, and perhaps the university review and your own reviews will give us some really positive news, so let's hope so. So is everybody happy that we've finished that item? We'll move on then to, thank you to Heather and to Justin for presenting, and sorry Heather for all the technical problems. We did appreciate you bearing with us. So,
thank you.
Item 6 is the flat rate respite care ombudsman's report, and you're going to hear from Glenn, who's with us, and from Pam Clipson, who's attending remotely.
Thank you, Chair. Morning all. Can you hear me okay?
Yes, I think we can. Just say something else, Pam, just to make sure.
Okay, can you hear me okay? Is that all right?
That's fine, thank you.
Brilliant, okay. I'll make a start on the report then. For approximately the 1,200 people that we see enter short-term care every year, historically we had charged what is termed a flat rate to the individual for their care. The flat rate was based on the individual's age rather than their affordability. We reviewed our charging policy in 2020 and removed the flat rate charge. So in effect, it was only in operation till the 14th of April 2020. The charge was removed because it wasn't aligned to the Care Act 2014. It wasn't aligned because as the rate was set, no financial assessment was undertaken for the individual involved, which meant that actually we couldn't confirm whether or not the individual could afford to pay that set charge. The new policy that we now have in place from April 2020 ensures that individuals entering short-term care are offered a financial assessment, and any applicable charges are based on the temporary residential status that they undertake, and that is in accordance with the Care Act. We did find ourselves in a position, however, that the flat rate had been in place since the Care Act was introduced in 2014, which meant that we had potentially overcharged up to 1,525 individuals. The scale of that potential overcharge is estimated at £500,000, and that is built into Adult Care and Community Wellbeing's financial forecast. There are numbers in the report around the progress that we've made. However, I do have a more up-to-date position. As of Friday, we have written to 286 of those individuals, and their potential refund is £96,500. 72 of those individuals have responded, and we have paid out £25,330. We have started those individuals, the full 1,500, with those that are impacted the most. So as we work our way through, the impact on individuals is reducing. We are on track to write to all of the 1,525 individuals by the timescale we agreed of the 31st of October 2021. This issue did feature as part of an Ombudsman investigation, and the report was published by the Ombudsman on the 16th of March 2021, and that is appended to the report in the packs that you've received. Wasn't going to go through any more detail, but happy to take any questions on the report that you've received.
Right, Councillor Young, I saw your hand first.
Well, thank you, Chair. My concerns, Chair, isn't about the monetary value of the amount which is being discussed, but that of those people where at a time of need of care, and respite is normally at a time of where it's either planned or they're in desperate need in terms of respite provision or I suppose relief of carer support. That flat rate charge of the respite charge is a disincentive for a lot of people where they would have chose not to go into respite. And I know £80, £90 doesn't sound much, but for a lot of people, they would have chose not to enter respite care as opposed to really needing that care and should have had that care provided. And I just think this is a real sad indictment really, in terms of the position where we're at. That, you know, many people who, especially around mental health, they needed to go into care. They needed that respite for, you know, for their own mental health and for the carers. We found ourselves in a situation, and the monetary value doesn't really come into it for me. I think we've let people down across the county. There's an awful lot of people who wouldn't be included in these figures who have chosen not to have care when really they should have been entitled to it. And it'd be interesting to see in terms of how, you know, the future figures looked moving on in comparison to the last couple of years, where, you know, has there been an increase in respite provision or not? But I just think we've got ourselves into a poor situation here, and it will have impacted on people, and I think we need to note that.
Thank you, Councillor. Is there any information on whether respite use has gone up since 2020, do we know?
I mean, I can come back in on that one. I think it's a very difficult year because respite wasn't available in a lot of cases, or it was available in different manners through 2021 as a result of COVID-19. So actually our numbers at the moment are showing down for actual face-to-face respite, but up for non-face-to-face. So I think that it's a bit of a poor year to monitor the activity numbers. I think there is just the other bit we need to point out, that should any individual, or where any individual doesn't take up the offer of care, that is picked up by our frontline service users to avoid, not just for flat rate, but at any point in time, if an individual feels that the care that they need isn't affordable, that is picked up by our frontline workers with that individual at the time.
Glenn, I think you're going to just add something. I'll come on to you then, Karen. Glenn first.
Thank you, Chair. So, right, this is a complicated area and not necessarily within the gift of the council to determine, because much of this is set nationally. The point that Councillor makes regarding mental health is picked up in different legislation. The Mental Health Act provides for free aftercare following a intensive period in a hospital for a mental health crisis. It's a Section 117 notice, and we have a number of people with mental health needs following a hospitalisation, and they are covered by that notice, which provides for free care. It's a piece of legislation that creates a bit of a disjuncture between other people who need, as it were, respite support after a hospitalisation. If you have a physical disability, you will not be you will not get a free respite provision. In terms of older people receiving respite care, the numbers in 2021 grew for respite provision, but it's complicated in terms of why that took place, because as we know, a number of home care providers lost a lot of capacity, and in an emergency, we will offer someone respite care in residential settings as a place of safety whilst we're arranging a care package. So respite care can grow in number terms because of lack of capacity in home care as much as it can, because that person needs that before they move home. In addition to that, I think it's important to note that the council operates a financial charging regime in line with government requirements. The Ombudsman can sometimes take a policy view of that charging and how it applies, as opposed to coming directly from a complaint, i.e. a case of maladministration. And it's interesting that this particular Ombudsman, who came into post about 4 years ago, has taken a very strong line on policy decisions, particularly around charging. We're not the only council to have been in discussion with the Ombudsman around interpretation of the policy as set by government. We have, and members I think have seen previous reports around Ombudsman decisions related to policy interpretation as opposed to a complaint about our application of that policy. So we've often found ourselves in debate with the Ombudsman around that interpretation. What this allows us to do, though, is make sure that we're as tight as we possibly can be, only charging those people where there's a legitimate charge to be made. We believe that we're in a very good space with that. But it's also the case that because that policy area changes quite frequently, we're constantly having to update it. And it would also be fair to say, and I don't think Pam mentioned this, that for people receiving flat rate care, there were people who would have been charged more but weren't, and people who were charged more and shouldn't have been. So we found ourselves in a middle position, in which case the then portfolio holder took a view which was we would, as it were, recompense people who were charged too much, but we would not pursue people who were charged too little. Thank you, Chair.
Thank you, Glenn. I think Councillor Lee just wanted to come in there.
Yeah, a few points. Just I agree with everything you say. I think it's shocking. It's utterly shocking. We got it wrong. And the fact that we're not the only council, that doesn't actually make it any better. And I don't think we can pass the buck to government either. It's just utterly, utterly wrong. And it's a shocking failure, really shocking failure. And I think I would ask two questions, really. Why is it going to take another 3 months until the end of October to repay this money? I'm sure if it was somebody getting their gas cut off, it wouldn't take 3 months to cut them off because they hadn't paid the bill. Why is it taking 3 months to get the rest? Because obviously it's going to be more than 3 months from when they started paying them back. Can it not be paid back any more quickly? Because actually I think that the money does matter. And actually, as well as that, you've been sat on people's money. Are they going to get paid interest for that? Or will they simply get back, you know, what they've been overcharged? I think it's awful. I'm sorry. It really is wrong.
Thank you, Councillor.
Do you want me to come back? In terms of why it's taking 3 months, a lot of these people aren't in our care anymore, and after they've had their respite have actually left LCC's care, so we're having to track them down. We can also only offer them a refund. We don't have bank details to automatically pay it in, so we have to track them down, offer it, and then they come back to us to say yes, they want it and provide their bank details. We are, just because of the environment we're in, struggling. People actually don't believe that we are Lincolnshire County Council and are giving them a refund, that they think it's some sort of fraudulent activity. So that is why it's taking us so long. We have no means to automatically pay this money into people's accounts because they are no longer in our care and we don't hold that detail.
Pam, could I just...
Can I just come back, because you haven't answered what I asked you about paying them interest. And actually, I really don't see that it takes 3 months to contact people. That is a long time. That's a quarter of a year. It's 1,500, not 15 million people. 3 months is a long time, and I'd like an answer about if you're going to pay them interest on your money their money that you've been sat on.
We haven't got an intention to pay interest now. I think the largest payment back is just over £2,000. Which is a lot to individuals. I think the second largest in the paper is about 1,500, but at the moment there isn't any intention to pay interest now. And again, we have a team of people that are working on this, but each individual case is different. So we have to go through and say, as Glenn rightly says, what they were charged, should have been charged compared to the flat rate assessment. And we have to work that out on an individual basis to be able to get that refund value quantified and back out to them. That's the element that takes the time, not the actual writing of the letter. It's the actual
Can I just ask then, if you're not
in
intending to pay them interest, it's quite a nice position to be able to take that position. Do they have legal recourse? Because it's just wrong that they've been overcharged. It's utterly, utterly wrong. And would they have legal recourse to try and, you know, to right that? Because it shouldn't have happened.
Each individual could take it further if they felt they wanted to. We haven't come across that issue as with the number that we spoke to at the moment.
Could I just ask Pam as well, just a follow-up question? I think the highest amount that's owed is £2,523. How has that come to that amount when it's sort of the flat rate charge is £138 a week? Has that person had more than one period of respite care?
That's absolutely correct. Yes, we had two people out of the 1,500 that did have either multiple episodes or a longer individual episode, and hence that value. And that's why we worked with them first, and those two have been resolved as a priority.
Now we've got a question from Councillor Mr. Clark.
Yes, thank you very much. In reading the report, I understood we paid £300 compensation because of the maladministration that we went through. Is that correct?
I think this might have been another report, but I could be wrong. Perhaps Pam can clarify that, or Glenn.
I think that is a different one, but I will double check.
Yeah, that was a different matter altogether.
Okay, thank you for that. Regarding the numbers that we've identified, did we write to every one of them, or are we writing individually, so we're still catching up with writing to individuals to apologise?
We're writing to each individual because each refund is tailored to that individual. So we can't just send out a blanket correspondence letter. We did, following the Ombudsman's report being published, we did put a response out there to say that this would be happening, but each letter is tailored to the individual themselves.
Thank you.
Do we have any more questions from councillors? Councillor Mrs Overton.
Apologies for being late. Just a question, some people will have died, presumably, so they'll need compensation to the family or something like that. Is that going to be worked out as well? Thank you.
A decision was taken early on in the process that that wouldn't need to happen because of the distress to the families. So no, that won't be taking place. That was made in last financial year, that decision.
Are you sure that's okay with the Ombudsman?
Yes, that is. We have put it into the response to the Ombudsman, and the Ombudsman has accepted that, yes.
Thank you.
I think if some of the amounts are quite small, it could cause distress to the families. It is a very, very valid point. I know from families I deal with, there's nothing worse than getting letters months after someone's passed away. It can cause more distress probably than the good that it might do. So I think that's probably a good thing. Councillor Kendrick.
Thank you, Chairman. Clearly this has been terribly distressing for the people involved. I was just wondering, in terms of context, I can't recall over the last 4 years, and I may be wrong, have we had any similar Ombudsman inquiries and direction from the Ombudsman on other matters similar to this?
There were some papers sent out just in the last week or so with other reports to do with top-up fees, I think.
Thank you, Chair. This was related to gross versus net payments, and again it's a matter of interpretation of policy guidance from government, where the council previously paid providers and the Ombudsman took a view that we should have been paying a different amount based on net rather than gross. I think I've got that right, Pam. The consequence of that was that the council took a view that it should accept the Ombudsman's findings, and so as part of the overall changes around financial assessments, we've moved to gross from net, which actually moves the work to the council from the providers of care. That is also proving very popular with providers, because they're not, as it were, having to manage that themselves. But in order to do that, we've had to implement a number of changes within the council, many of which are related to ICT improvements in terms of processing. And that has allowed the council to say, yes, it will accept the Ombudsman's recommendations in that case. Thank you, Chair.
Thank you. Councillor Mrs Clark.
Yes, thank you for that, Glenn. Part of my questions were around that. Could you explain to me the IT systems? I know they've now been sort of channeled down to 3 systems. Is that making a financial saving for the authority now that you've done that? Because we're coming in at the back end of all of this now, I understand, after reading it. So has that made a difference to the council as far as charging policy and saving money on that? And also, can you tell me, it is terrible, I'll pick up what Karen said there, it is terrible what will have happened to these people, not undercharged so much, but overcharged, and it would have been distressing. And reading all of that background information, the distress caused to that particular family, having to look into how to get back, as it were, how they've been treated and how to fight the council. And it was a fight. It's very distressing. So what about reputational damage to the council? Nobody's talked about reputational damage. Did we suffer reputational damage because of this, please?
Thank you, Chair. So, yes, of course, if the Ombudsman finds against any council, which he does quite frequently, that does have a bearing on the council's reputation. By and large, they tend to be short-lived, if I'm honest. And we've had some inquiries because other councils learn from Ombudsman's findings in a colleague council. So there's a recent case involving Norfolk that we've all been, as it were, involved in a learning so that we don't fall foul of an Ombudsman's recommendations. But that does tend to be short-lived. I should also put this into context in the sense that the Ombudsman typically reports a couple of hundred cases a year. Over the last 5 years, we've had 2 cases found against us. So we tend to be fairly robust. We try to learn as much as we can, but I would remind members this is a very complicated area. NHS colleagues do not have to, as it were, endure a charging regime, which in social care exists for adults. Having said that, we are hoping that the ICT improvements that we've made will have a bearing not just on the number of people we have to employ to manage what was previously a manual system, but also that they will allow us to charge people more quickly because it's all online, rather than lots of letters going backwards and forwards, which was taking far too long. So a better customer experience and more efficient in terms of the council. In terms of savings, I'm not expecting a great deal from this, but it is about improved customer experience.
I think it's perhaps as well what we can learn from it for the future, because there is a lot of changes coming, we all know that. So really, we don't want to go down this path again. So I suppose my question or comment would be, what can we learn from it really to save it happening again?
Thank you, Chair. I don't know whether Pam wants to come in on some of this as well, because part of this relates to finance procedures and processes.
Yeah, I mean, when I came into the council in September 2019, Glenn and I embarked on a full review of our charging policy, and we have gone through all the aspects that we charge, so that the policy that came before scrutiny and executive in April 2020 does align to the Care Act that came in 2014. As Glenn says, that there are aspects that do keep coming up because it is a fluid situation, but we have now got certain, what I would call fail-safes in place. So for example, we have something in place that should an individual's charge either increase materially or unexpectedly, that there is a fail-safe that calculates whether that may put an individual in distress, and those cases come through to Glenn and myself and the ADs to start to actually say, actually, is that a fair charge for that individual? Which is something that we've introduced during 2021. I accept the position that we're in through the flat rate is unacceptable, and it caused significant amount of distress. The lessons that we've learned is to review all of our charges, to add that fail-safe in, and to monitor each of the complaints that we get and that come through with the individuals and their families themselves.
Thank you, Pam. And these reviews, will there be regular reviews so that it's not just a one-off after this? Are you going to review regularly?
We do. So the policy itself is up for review every 4 years, but on an annual basis, the government publishes new rates and new charges. So we will review the policy in line with those, but we also review the policy after any judgment. So for example, Glenn referred to the Norfolk judgment. We were actually found to be more protective of service users and therefore not applicable for what they found in the Norfolk case. But we would review after any such case like that. And again, if we had a material complaint or a finding from our service users or frontline workers, some of our frontline workers do report back some comments made by service users. So it is a continual process.
Councillor Mrs Overton.
Thank you. I think you're going to keep the flat charge, which means that we're not Is that right? And we're not looking as closely at every single individual.
No, we're not keeping the flat. The flat charge has been removed now. So all individuals go through a financial assessment, which means that the contribution they make is tailored to their financial position. There aren't flat rate charges any longer since the 14th of April 2020.
Right, thank you. So it's, you said in here that it would cost £1 million, I think it was, to do the assessments, going back on just on paragraph 26, I think it is.
It's not £1 million, I don't believe.
So the question is this a huge new cost? I gather you're saying you've got some ICT improvements, but I think having helped people in the past, one of the main complications is getting their papers, finding the papers that are needed. And that seems to be quite difficult in often quite chaotic homes. So I don't know if that's... you know, is there any way around that? Are we using something else, like their national insurance number? Thank you.
So there are two mechanisms. We don't want to remove the opportunity for people to use papers, particularly for the client base that we deal with day in, day out. A lot of them are more familiar and more comfortable with paper-based systems. But we have now introduced our online support, an ability to use online for financial assessment so that people can upload the paperwork, so we don't, you know, we've got it easily accessible. For those that do want to continue with paperwork, we have significantly reduced the size of the financial assessment, but also the amount of evidence that they need to provide into that financial assessment. So we have reduced significantly the amount of paperwork should they still want that system and process.
Thank you.
Thank you, Councillor. Well, under this item on the agenda, we're to consider the report and determine whether we support the recommendations to the executive, which are set down on page 11. Is everybody happy with those recommendations? Okay, yes, we're all happy with that. And to agree any additional comments that are passed on to the executive, do we have anything additionally that we think we should pass on? Councillor Lee.
I just want to say, I know it's only a figure of speech to say that we're happy. I'm far from happy, actually.
Yeah, sorry, I didn't mean...
I think we agree to it, yeah.
We agree to it, yes, you're quite right. I do apologise, I'm not happy either. We have discussed that these are some vulnerable people involved, but we will approve the recommendations to the executive, and I don't think we have any additional comments other than what's covered in the report. Councillor
Sorry, just to pick up your point about review. Thank you.
Thank you. Yes, we're pleased that these charges are regularly reviewed. Okay, thank you. Right, let's move on to item 7, service level performance against corporate performance framework for Q4. Is Caroline presenting this? Yes, she is.
Thank you, Chair. Hopefully you can hear me. I'll just check if everyone can hear me.
Yes, we can. Thank you.
Ah, super. Thank you. So page 29 of your pack has the report which outlines the performance for Q4. This is performance compared to the targets that we set. Page 33 to 72 has the full detail for each of the performance indicators. Firstly, I just want to apologise. There's a correction on page 29. So it should read that we have 11 measures that have achieved their target. 4 didn't achieve their target and 5 can't be reported in this period. So that's 20 measures in total. I'd first like to highlight that of the 11 measures that where we've achieved our target in Q4, a number of those will have been affected by COVID-19. And I think given the impact of COVID-19, as we've already discussed earlier on in the session today, you know, the whole care sector has been impacted, and it's a testament to the adult care staff that many of these measures continue to achieve their target during some of the most challenging of times. So to summarise those that are achieving, the permanent admissions to residential and nursing care homes for clients aged 65 plus has continued to reduce, resulting in the performance being exceeded. This is in part due to the work of the teams to help make sure that clients stay in their own homes longer where it's appropriate. However, it's undoubtedly been impacted by the pandemic, where we saw at the start of the year less contacts for new clients being received into the council, and therefore the number of people receiving a long-term service dropping. Adults who received a direct payment continues to be above the target, along with those people in receipt of long-term support who've had their needs reviewed. For all requests for support from new clients aged 65 or over, the proportion where the outcome of the request was no support or support of a lower level is also in line with the target that we've set. As you'll be aware, reablement is an early intervention for vulnerable people to help to restore their independence, and although the completed episodes of reablement has reduced from last quarter, it's still within the tolerance range set for Q4. 99% of the people exiting our wellbeing service were able to demonstrate improvements across the outcomes they identified when entering the service, so a really positive outcome. And the delivery of emergency and urgent pieces of equipment, which is often crucial in situations when these requests are received, to ensure that individuals receive the equipment required to support their discharge from hospital or prevent a hospital admission or during end-of-life care. In Q4, 99% of our emergency and urgent deliveries and collections were completed on time. The percentage of people who remain in their own home 91 days after discharge from hospital has reduced last quarter, but still remains within our target at 87.4%. And although we'd perhaps expect that the percentage of people aged 40 to 74 offered and received an NHS health check to be impacted by COVID, just to point out, we are yet to see this in our reporting due to the lag in data that we receive. So we are significantly behind in terms of that reporting period. We do expect to see that going forward into next year. We've already discussed safeguarding in the previous paper, but to say that 2 of the measures within the safeguarding arena have performed very well, with safeguarding cases supported by an advocate, and those concluded safeguard inquiries where the desired outcome was achieved, both also achieving their target. So we do have some measures that didn't achieve their target, and I'll go through those now. So we talked about safeguarding earlier. We know that a number of adult safeguarding concerns which did not progress to an inquiry is increased. We, as already previously discussed, recognise that the pandemic has impacted on this work with partners around the reporting of concerns, and it's possible but there was a decrease in opportunities for face-to-face contact, resulting in a more cautious risk approach. However, we continue to monitor this, as Heather pointed out and Justin spoke about earlier, working with our partner agencies, with the Safeguarding Board, to ensure that the quality of recording of these concerns improves and that we ensure that these inquiries are being reported appropriately. Adults aged 18 to 64 living independently is below the target in Q4. We are in the process of revising the definition and we've reported this in the past around this measure due to changes in the care programme approach. So from Q1, we will be reporting the total cohort receiving a service within our Section 75 agreement, and of these, the percentage being supported to live independently within the community. So this will be a more accurate reflection of the position in Lincolnshire. The number of alcohol users who left specialist treatment successfully has decreased from 30.8%, has increased from 30.8% in Q2 to 32.9% in Q3. It's still obviously below our target set. Obviously, the service is feeling the impact of the COVID-19 pandemic, and this is reflected in the performance figures. But as previously discussed at committee, services are continuing to use innovative ways to engage with their clients, and learning from this will inform future service and delivery. One U Lincolnshire has achieved 67% of its targets for people supported to successfully quit smoking during this reporting period. Again, as a result of the pandemic, the service is continuing to provide a phone and digital support for smoking cessation. Again, I know we've discussed this previously at committee in terms of ensuring that nicotine replacement therapy is delivered by post in order to maintain their programme. The new delivery model continues to maintain the stop smoking service, but the subcontracted services with pharmacies and primary care settings remain suspended, which with the exception of a few who continue to deliver during lockdown. So there are 5 measures, as I mentioned, that we can't report on in this period. 3 of those relate to a survey that is normally conducted where we ask our carers and service users, but due to central government cancellation due to COVID-19, we haven't conducted those surveys. We're also reviewing the definition of one of our measures around the care our carers are supported, and we want to include young carers in that measure. So we've got the widest carer community, and so we'll be looking to report on that in Q1. And currently we are unable to report around housing related support due to their IT system being under review, and we're unable to access data at this point. Just like to also finally say we have recently submitted annual data around adult care, and the comment that was made earlier around benchmarking data. We should be able to update some of our benchmarking data sort of early autumn when we receive the national comparisons. I'd now like to hand over for any questions.
Thank you, Caroline. Yes, question from Councillor Mrs. Carter, please. Tracy first.
You married me off.
Sorry, Tracy.
Thank you, Chairman. Apologies for anybody if some of my questions are a little bit random, but obviously I'm new, so I'm just trying to get some concept behind some of these KPIs. So maybe if I do a couple and then maybe move on to
don't be frightened to ask stupid questions, because
well,
now's the time.
So on page 37, obviously, yes, a high percentage result there in regards to the review, but I'm actually trying to understand how well done is that? So what does the review actually entail? Is it literally a call to kind of see how things are and see if everything's the same? And how thorough is it for me to get an understanding how hard that target was to hit? And I'll do one more and then do the answer on there. So then on page 39, I find this a really strange target, and I would possibly view this could almost be detrimental at times. So the request for support for new clients where the outcome was no support or support at a lower level. So to me, there's people coming to us asking for support and saying they're needing support. That's why they've made that call in the first place. And this is where we're finding them lower level support. So I'm struggling to understand how this is a good measure that we're doing. And actually, some people again falling through the net on there. So that's two.
They were really good questions. Thank you.
Thank you.
Thank you, Chair. In terms of the reviews, Glenn may want to also contribute in terms of, it is obviously a number around, a compliance measure in terms of have we undertaken the review, but the review does look at the care package, obviously, and the client, and there is obviously conversation with the client around an assessment of their situation. So, and undoubtedly we do need to factor in, and there are quality assurance measures around that as well. So we do look at the quality of those reviews as well. But obviously, this is, as you say, a compliance measure in terms of those reviews being undertaken, but it is a review of their care. I don't know if Glenn wants to add anything further before I move on to the...
Thank you, Caroline. Thank you, Chair. Yes, indeed. Reviews are seen nationally as a good thing to do. And page 38 gives an indication of where we sit in terms of reviewing performance. As councils have increasingly struggled to match need with resources because of austerity, a lot of councils have ceased to prioritise reviewing. We didn't. This goes back to 2012, when reviewing performance in the council was about 39%. What that means in practice for the individual, though, is that nobody comes and has a conversation with them that says, is what you're getting meeting your needs? Recognising that so many people will change in terms of what their needs are, particularly over the course of a year. By the same token, reviewing performance has been looked at in detail, and we've got an improvement programme because about 80% of reviews lead to no change. Now, that might be a good thing because some people don't have a change. But we want our frontline practitioners to be a little bit more inquisitive about whether services are keeping people dependent or whether other things would help them become more independent. And what we found is by changing practice at the front line, that more people's reviews are leading to a change in service. Not always less, sometimes more. So that's a good thing. And nationally, the government has maintained this as a benchmark of quality practice. Thank you, Chair.
Did you want to answer the other question of Councillor Carter regarding the request for support for new clients? I think it was, wasn't it?
Yeah, there was the low-level support question. And again, I'm sure Glenn will want to come in and say, you know, I would say low-level support doesn't equal an inferior level of support. I think it's that, you know, appropriateness. But actually, I think what we would identify is that often that lower level of support initially, you know, is a better outcome than going in with a higher dependency package of care. But actually, it's ensuring that we get that the people come into us into services earlier and get that low level of support before coming to us at a time of crisis. Or at a point when the only option is a higher level support package. And I think that's what we're trying to drive at there.
Thank you. Councillor Kendrick had a question next.
Thank you, Chairman. It's not so much a question, more an observation, and I think I've done this before in the previous term. The percentage of alcohol users that left specialist treatment successfully not achieved, I think this is a pretty consistent thing, and I think whilst targets are obviously important as a way to gauge performance, in the case of substance and alcohol abuse, and from my limited experience working with people with these problems in the past, it's not something that you can necessarily guarantee you will achieve, because we're dealing with people who have got serious issues, and there's a lot to do with personal determination to overcome the issue. So whilst I wouldn't say I'm relaxed about it, I can understand why it's very difficult to achieve that target. Thank you, Chairman.
Thank you, Councillor. Tracy, did I cut you off?
No, you didn't. I was just going to come back
Microphone.
Sorry, Chairman. No, you didn't. I was just going to slightly come back on in response to my question before in regards to the low-level care. I think my point was not thinking that low-level care is a bad thing, but actually, is it taking the client along with them? Are they happy with just being given low-level care? Is that what they was looking for? So it was more kind of very much understanding that. So thank you.
Glenn.
Thank you, Chair. Just quickly on the lower levels of support, why is this a good thing? What we find is that there will be times when we have over-prescribed care and support to people, often because of the crisis that they're in, or because they're leaving hospital and there's a pressure for people to leave hospital as quickly as possible. So there are times when frontline practitioners will over-prescribe support. It's also important that we review people as quickly as we can, because that can lead to a dependency which does not actually give them a longer term sustainable level of support. For those councils, and there are a number in the country, who have a open door policy, come to us and we'll do what we can for you, they have typically now become financially insolvent. Bearing in mind that we can, as it were, deliver good quality services, but we have resource constraints in which to do that. So what we do is very important in terms of managing within our means, but also not creating a long-term problem. What we find also is that the national research on what people want from us is very, very consistent over time. They want to have more independence. They only want us when they really need us. But when they do need us, they want us to be there as quickly as possible and to provide good quality care and support. So it is seen as a good, but also some of the things that we're able to provide, Caroline's already talked about the wellbeing service, short-term care, reablement, equipment and adaptations. All of these allow people to retain their sense of place in the community, because the other important thing that people keep telling us is that level of connectedness that's so important, and more independence often relates to higher levels of connectedness within community. Thank you, Chair. In terms of the alcohol abuse, absolutely agree with Councillor Kendrick. We are so dependent on people being compliant with a treatment regime, which is not always easy to secure, particularly at a distance when it comes online, because many of the people who we are engaged with will not necessarily be motivated in the way that others might to come off drugs and alcohol and generally addiction. So we have to work very closely with other agencies, health colleagues, police, not least. It does not always lead to successful outcomes. I have to say, though, that the performance that we're seeing, and the ambition is to be upper quartile. It's a consistent message, which is, if we have a target, it's the target to be upper quartile. But of course, that's compared to a lot of other councils, some of whom don't have the rural issues that we've got. But it is reassuring, I think, to see progress despite the impact of COVID. Thank you, Chair.
Thank you, Glenn. Councillor Young.
Thank you, Chair. Direct payments, fantastic achievement, I think, in terms of the report. I think it's 39%. I think that's really...
Did you just want to wait, Councillor? There's some noise outside the chamber, and I don't think anybody will hear you. Off you go.
Yep. Thank you, Chair. Yeah, direct payments, Glenn, I think fantastic achievement in 39%. I think that's excellent. Just in terms of the data around the outcomes for direct payments, can you tell us whether that direct payment achieves a better outcome for individuals? Have we got the data around that? And financially, does that is that better for us in terms of authority, in terms of delivery or not?
Thank you, Chair. I'm happy to answer this, but Caroline might want to come in due course as well. So, finances, does it lead to better outcomes for the council and for the individual? Typically, yes. There's some decent national data on this, but also we've done a local benchmarking exercise a few years ago. People who use direct payments typically spend less. They see it as their money. And there's a universal truth here about the general public's access to public services. If people, as it were, control the resource that's there for them, they often are able to have more flexibility in how they use that resource and are very cautious in how they use it. It's one of the reasons why a retail model for equipment services is so important, because if it comes to you freely, you'll take what's on offer often. If you're responsible for the budget that gives you access to things, you tend to be a little more prudent. And people receiving direct payments cost the council less typically. That doesn't mean they get less quality services though. Because the other thing that people can do that the council can't is that they can go to providers who we can't, because we are bound by the legislative requirements to only approach providers who are CQC regulated, Care Quality Commission regulated. So families, friends, neighbours sometimes get involved in direct payment support that we cannot access because they're not CQC regulated. Thank you, Chair.
Thank you, Glenn. Did Caroline want to add anything?
Yeah, I'd like to add, I think that's an absolute fair point around, is there a better outcome? I think, we have looked at how we can extract data and analyse that, and that's something we've got kind of in our work plan to to be able to do. You know, it's a complex, isn't it, in terms of, you know, how, and this comes back to the previous question about the reviews. You know, there's qualitative data in there in terms of the impact on the individual, and hopefully we'll be able to extract some of that and compare that to clients who don't have a direct payment. But obviously it is quite a complex area in terms of understanding, you know, what is an improved outcome and what isn't. So yeah, we're certainly happy to look at that and see what else we can provide.
Thank you. That's a really interesting question, Councillor. Thank you. I just got one myself on the adult safeguarding concerns leading to a safeguarding inquiry. On page 55, it mentions people referring safeguarding concerns only where appropriate. And I wonder whether that's where part of this problem is, that perhaps more training might be needed in some agencies as to which concerns come to us and which don't. Thank you.
If I take that one, Chair, and again, if I miss anything, Caroline can help me out. So the number of agencies involved in safeguarding can sometimes be more than 15. Some of the safeguarding adult reviews that we've undertaken have involved more than 15 organisations trying to help someone. It's one of the reasons why team around the adults is so important, because people can lead very chaotic lives, and a lot of organisations are playing out in their world, not always joined up. This relates directly to the number of concerns that we get from those agencies. And a concern is when someone phones us up and says, I'm worried about Mrs. Green. An inquiry is when we say, yes, we've got that concern and we think this is a safeguarding matter. About 2/3 of all concerns do not lead to a safeguarding investigation and inquiry. Now, in our world, that's a waste of very expert resources, because then we are going out and engaging with people only to find that actually it wasn't a safeguarding inquiry in the first place. So training is critical, and it was one of the reasons why the Care Act made statutory adult safeguarding. Previous to 2014, adult safeguarding was a voluntary exercise in local councils. Some did it, some didn't. But it also stipulated in the Care Act that we needed to set up safeguarding boards, recognising that lots of different organisations, voluntary sector as well as statutory, needed to work more closely together if we're better to respond to people's needs. So this is a rather extreme example, but and I'm giving you 2 or 3 here. We've had cases where a concern was raised because there wasn't water in a dog's bowl, which fortunately did not lead to a safeguarding investigation, but individuals in the community, a GP, a nurse, a social worker in another council, a police officer can raise a concern with us, but they will not always apply the same threshold that we would, that says that's genuine safeguarding concern. So the issue of education is critical. Whereas children have been playing out on child protection for over 40 years, at the beginning of my career, which unfortunately lasts that long, I was involved in child protection, and child protection in those days was relatively young and naive. Nowadays, it's become much more sophisticated. Adult safeguarding is still embryonic. And so we will still be working this through for years to come. But it's also more complicated in adults because more organisations involved and because people tend to create greater complexities in their lives as they age, as they become adults. So, for example, we will often find, sorry, I'm on a soapbox, I do apologise, yeah. But, for example, we will often find that an abuser in a family was abused at an earlier point in time. You don't get that in child protection. So it's often much more complicated. And of course, adults have resources, they have money, they have assets, they have things that can be stolen. And again, it makes it much more complicated.
Yes, thank you, Glenn. Councillor Carter, I think you can have one more.
I've got 4. They're little though. Okay, page 51, it was purely more a statement, and I know you referenced it in your report, but the case is supported by an advocate. I would find that hard to understand how that could ever be 100%, so I'm baffled as to why it's actually a target in the first place. On page 55, it does follow on from Councillor Key's comment Chairman's comment in regards to the safeguarding inquiry. This target's still similar to the other one in regards to the low-level care. This is a target that still concerns me, because what I wouldn't want is people to be pushed back when they have an inquiry, although I take all of what you've just said, Glenn, completely on board. Targets worry me when people are very keen to hit them over a matter that could be quite detrimental. So it was purely, in my view, that has a little concern for me. On page 61, let me just quickly scan to it. The alcohol users, again, they've been brought up a couple of times here. I personally feel the target is incredibly low, but actually I would also be interested to know in 6 months after this, so we're measuring and we're close to target to those who have successfully finished the 12-month treatment, but actually how about 6 months after that, after they've gone, so a bit more data behind the actual figure that we've got here. And again, is there anything more we can learn from other councils on that? And finally, very last little one, in page 65, the percentage of people supported to improve their outcomes following wellbeing intervention. Where's this opinion coming from? Is it client-centred, or actually is it clinician-led as to actually those improvements in the outcome? Is the client really truly agreeing with those measures? Thank you.
Thank you, Chair. Do you want to let Caroline come in, because she's probably sort of loitering in?
Yes, let's do that, if you can remember what they all were.
Yeah, I think so. I think the safeguarding advocate is there. It is there to ensure that there is that advocacy element, and I can certainly look back in terms of that's been 100%, I think, for some time, which I think is a really positive thing. But take on board the point of why would and there are a number of measures there that could be seen. So why do we have that? But it is there about ensuring. It's an assurance, isn't it? It's about giving that assurance to you that these things are kind of taking place. In terms of safeguarding inquiries, I think, again, just to reiterate Glenn's point in terms of, it does identify, and Heather raised it earlier, if we have got a significant proportion of safeguarding contacts coming through that don't lead to an inquiry, then clearly it acknowledges that there's something needs doing in relation to our training and the understanding of agencies, because otherwise, as Glenn says, we are then spending a significant proportion of resource dealing with very, very low level inquiries. So it's about then trying to ensure we've got that proportion right. I think we've covered off. The alcohol, I can certainly look into what further longitudinal and data is available, because I think it's an absolute fair point. But this but longitudinal data is often difficult. But I'll certainly look into that in terms of what we can get. And we have raised other local authorities in the past, but we'll certainly pass that again through to Derek Ward in terms of what else can we learn from other LAs. In terms of the wellbeing intervention, that is through the individuals. It is through a conversation with the individuals around what were their the outcomes they wanted to achieve at the start of that intervention, and did they feel those outcomes were achieved at the end. Excuse me. So that is based on the client, client's views.
Lovely, thank you. I think are we there now? Oh, Councillor Overton.
Thank you very much indeed. I'm just thinking about how the budget has been balanced, and I have to say this department has done remarkably well, I believe, over quite a long period of time, so which is all credit. But I am thinking that if there are going to be extra costs, for example, in extra assessments or anything like that for financially, are we going to be able to manage in the future? And the second thing, if I might, is to have a look at again, it's where you put the money, and you did talk about the review of assessment, and I can see the good sense in that, but we also have the first assessments, and we've been doing those online, the very initial one. But recently I had a case and I got a call back saying that the person was ready to be allocated to someone to do the assessment. That sounded to me like nothing. So I'm just thinking, are we still managing to do these assessments? Because I can't see it in the paper. Those first full assessments, so if they go past the phone call and they need a proper assessment, are we still on time for that? And I don't know if that's still assessed. It used to be. And one of the other things we used to look at is the hospital readmissions, because we were looking at whether people got the care they needed when they came out of hospital, because if they didn't get that care, they were often straight back. So we used to look at the percentage hospital readmission. So I don't know if there is another measure that we're using to make sure that we're giving that care that they need. Thank you.
Yes, thank you, Councillor Glenn. We'll come back to you on that.
So, thank you. Managing into the future. Members will perhaps get the opportunity to look at that when Pam reports on financial wellbeing within the council. I think it's fair to say that local government in general and social care in particular, both children and adults, is finding it increasingly more difficult to cope. It's one of the reasons I think why there's a lot of noise in the system, in the media, at parliamentary level, with select committees notably reporting to ministers that social care needs additional resourcing, and it needs a long-term financing plan, which the government have committed to providing, arguably later this year. In fact, earlier this morning, the National Association of Directors, ADAS, published a report against the council's current financial positions. Many councils are not coping with the pressures that they're facing, and that includes assessments, with growing backlogs of assessments. To be fair, here we have a medium-term financial plan which probably gives us a very good chance of living within our means both this year and next year. That's pretty unusual. And of course, none of that assumes that the government will give us more money. If it does, then we will be okay for 2 or 3 more years at least. If it's a long-term plan, which I very much doubt it will be, then we'll be looking at 4, 5, 6 years ahead, and I'll be able to report to you we should be okay financially. So that's the first thing. The second is in terms of assessments. In occupational therapy, about 3 years ago, we identified problems with occupational therapy assessment backlogs. And that was feeding through into district councils then about their ability to provide disabled facilities grants. We increased the resources within that service, and we've been reporting to the portfolio holder regularly on performance. It's also on the agenda for here, Councillor, in due course, later this year, I think. So you will get a report on that and how we've been able to improve. It's still a pressure point, and part of that relates to the difficulty of recruiting occupational therapists nationally. And then I think the final point was hospital readmissions. I can remember when the NHS reported on that frequently, and it used to be on the Secretary of State's weekly report. For some reason, in 2017-18, the NHS stopped reporting it. And it comes from acute providers. It's not something within our gift to manage. It was raised nationally that it should be brought back into national reporting. But I think that sits with the NHS, if I'm honest. And although we have tried to get those reports, it's not always forthcoming. I'm happy for Caroline to come back in, Chair, if you want that.
Yes, Caroline, did you have anything to add?
I was just going to add, it's actually an area we've been looking at in terms of assessments and timeliness, and it is something we're doing some work as part of the improvement work that Glenn mentioned earlier. And I think, you know, there is the complexity again around the initial conversation that takes place, and just thinking about the councillor's comment around having the phone call back. You know, we are looking at, and the data we've seen thus far, which we will do some further work on, is showing that actually, you know, assessments are carried out in a very timely manner, but appreciate we perhaps need to bring back some further detail on that for you.
Thank you. Now, I'm keen to press on because I think, Glenn, you've got to go soon. Can we just have a quick question from Councillor Clark, because I did have your name down.
You've cut me short. I had a number of questions, but some have already been answered through other means. But what I was concerned with is that we've had a large number of graphs and figures thrown at us, but what would be useful to know the numbers involved rather than percentages. If that in the next report could show the individual numbers of people being treated in the various areas. And the one thing that I was most concerned about was carers. What are we doing to help those that are socially isolated? Is there a programme that we're going to instigate, or is there something already going on that we haven't been reported on?
Thank you, Councillor. Glenn, do you want to come back in? I know you're going to come back in anyway.
Thank you, Chair. I will restrain any comments related to previous questions, but I'm happy to answer them individually if that helps. As to loneliness, that's a really important point, and appreciating that this is the first, as it were, proper scrutiny meeting for this council for adult care community wellbeing. It is one that I would encourage members to raise with Derek when he joins later this year on the preventative work that we're doing. 2 years ago, we created a social isolation strategy because we'd recognised that it was a growing issue in Lincolnshire. Not all councils have one. It isn't a government expectation. And we are also looking at whether we can do more investment in digital technology to support people who are feeling excluded and socially isolated. By the same token, it's part of the housing strategy that we've got, which is how do we build houses in the right place for people who otherwise would be socially excluded. The digital technology work is really interesting. Again, not many councils are doing this because in a place like Lincolnshire, getting services to people is really, really difficult. The consequence of that is that we've got to look at a digital platform for helping people stay connected. We know from the research that it can work, and people do feel better as a result of digital platforms like Skype, for example, or WhatsApp. Having said that, there is more that we can do, but it's not just this council, it's also how we work with our voluntary sector colleagues, because there's an awful lot of voluntary sector activity that could be, as it were, helping target some of those people who are most at risk because they're socially isolated. And the consequence of being socially isolated is that you're more likely to be scammed, you're more likely to have mental health issues, and you're more likely to end up in residential care.
I think I can just add to that I run a weekly bingo for 100 people that hasn't been operating since last March, and we've always said at bingo there's as much social work goes on there as anywhere else in the county, and the people that come are desperate to get back, and we're going to be back soon, and I dread to think the state that some people will be in, to be honest, because that used to keep them going each week, and it wasn't really the bingo, it was the fact that they got out and could have a good moan about things and meet up with people that they would never normally see. And I think you're right with the voluntary sector. It's going to be a huge challenge for us all to get these things going again as quickly as we can, really. You did have another point to your question, Councillor, about the numbers rather than the percentages, I think, didn't you, on the graphs? So, sorry, Caroline, perhaps you would like to come back about that.
Yeah, absolutely, no problem. We'll have a look. Certainly, we can include the numbers in some way, shape, or form, and make sure that's there for you. I think the other thing I was going to mention was just to be kind of rest assured, I'm sure Glenn will come in terms of carers. And although we haven't reported carers in our performance report, because that's based on a survey that's commissioned nationally, there has obviously been a significant amount of work supporting carers during the last 16 months. It's just that obviously this data comes from a national survey.
Yes, thank you, Caroline. Thank you ever so much for joining us. This obviously is something that's going to come up on the agenda all the time, the service performance. So it's been really interesting today, and I'm sure if there's still things that people are a bit concerned about or not quite clear about, hopefully it will come out next time. So thank you very much for that. Let's move on to item 8. I'm not going to have a break at the moment because I know Glenn has got to go soon. So if we could just do this item, and then we've only got the plans to do at the end then. So shall we move on to adult care and wellbeing financial position from Pam, who's hopefully still online, and from Glenn.
Yeah, good morning. I'm still here. Can you hear me still?
Yes, that's fine. We can hear you. As long as you keep to that volume, don't go any quieter.
I'll try not to. Okay, I am conscious that this report's going to be quite a lot of numbers thrown at you again for people who didn't really live through the adult care financial position over the last 12 months. So I'll take the report as read and just pick out some of the key points. Adult care closed the financial year with an 8.9 million underspend. And that has been predominantly driven by two areas. The first and foremost is the use of COVID-19 grants. Each area across adult care prioritised and redeployed both our own workforce, but also the workforce of the commission services we have to enable ourselves to respond to COVID-19. And what that enabled us to do was to ensure some of our business as usual costs were supported through the COVID grants. Now, I have listed on pages 76 to 79 just how much in scale adult care received through COVID-19 monies, and it totaled 72.67 million in addition to our usual budget. Now, in an ideal world, we'd have got that at the beginning of the pandemic. That didn't happen, and in actual fact, adult care was still receiving new grant monies right the way through to March 2021. And that made it very difficult for us to be able to respond to the best use of that money. But you'll see the tables attached again on those pages show exactly where and how we've spent the grant monies. And what we've done basically was dovetail the two together. So we ensured through the development of our own sustainability fund that providers across adult social care, whether they were residential, home care, homelessness, whatever provider it might have been, had an ability to come to the council for additional financial support. Where service users weren't able to access the care that they would do normally because through COVID-19 restrictions, so day services that weren't open, for example, we provided additional one-to-one care. And where service users weren't in receipt of care, we didn't obviously continue with some of their charging. So I think the outcome of all of that actually enabled us to do more than we've done before and support those people, but it enabled us to carry forward some of the monies that we received. So again, the table on page 79, which shows the unspent grant monies, we have carried that forward into 21-22, and that's enabling us to continue to cover the costs of the pandemic during the early part of this year, but also some of the recovery areas that you have been referred to during this meeting, but also wider, where people have still not been able to, for whatever reason, feel comfortable going back to their services or able to go back to their services, or for people within our mental health and learning disability services, they've had additional one-to-one support that you can't just stop and take away from, you know, they need that continuing. So it does look very strange to be reporting an 8.9 million underspend in the middle of the pandemic, but that is because of the significant amount of additional monies that Lincolnshire did receive. And through the mechanisms that we have available to us, we have been able to carry that forward to enable us to continue to provide that additional care and resource and support across individuals and providers across our market into 21-22. The other elements are listed in there in terms of some of the more smaller underspends. The second one being our vacancy position. We did generate an underspend, £900,000 due to the slowdown in recruitment during lockdown. That is only a one-off, and we are not forecasting that that will continue as we start to pick up with recruitment into 21-22. Those are the only key points really, and I will just hand it over for any questions or anything Glenn might want to add. Thank you.
Thank you, Pam. Glenn, did you have anything to add at the moment?
Thank you, Chair. I'm happy to support any questions from members.
Thank you. Does anyone have any questions at the time? No? Oh. Councillor Overton.
We can't have that big underspend and not ask, is there any plan to do what to do with it? Clearly, there's huge needs, or is it about putting it in the bank? Because if it's there, the government will doubtless come after it. Thank you.
Yeah, no, absolutely. So we have already committed quite a significant amount of funding that we carried forward. So, for example, our sustainability fund, which is there to sustain cash flow into our residential care homes and our home care providers, of which we have over 350, has been in operation through to the end of June. We have also provided financial top-ups into those providers where the self-funders that would normally support their financial position just haven't been in their homes. So our providers are struggling financially, and we've supported that. We have continued, as I say, with supporting to service users who have had additional one-to-one care packages in place, and we are forecasting for that support to continue for the remainder of this financial year. In addition to that, we are putting in additional services where we've got, I don't like the word, but backlogs, waiting lists, where people weren't able to access, so things in our occupational therapy areas, those sorts of things, in our health checks where people weren't able to go into GP surgeries to have their health checks, these sorts of things. We are putting that money back in because our costs will be higher this year than our existing budgets would take. So there is a significant amount of costs committed, and as you see me come back later in the year on the 21-22 financial position, you'll be able to see how we've spent the majority of that money that we've carried forward.
Yeah, thank you, Pam. I mean, it does sound like a lot of money, 8.9 million, but actually I worked it out. It's about 14 days worth when you work out that it's 227 million for the whole year. So that puts it into perspective a bit, I think. Glenn, I think you were going to come in, and then Councillor Clark.
Thank you, Chair. Just a couple of points, if I may. The first is that it does sound like a lot of money, but our medium-term financial plan requires us to use a reserve which will include this in order, as it were, not to break the council's budget. And that will allow us to keep going for a couple of years, both in public health and adult social care, without, inverted commas, troubling the council's budget. That's really important for those councils who have not managed their adult social care budgets. They have no money in place, in the Place Directorate, for example, and they have less money in their children's services. So there's a ripple effect within councils of not getting that right. Having said that, we are expecting the government, as I mentioned before, to come with additional funding. The worry is that it'll only be temporary and it'll have a lot of strings attached. So the reserve helps us secure the long-term future, but also COVID has been 16 months of a completely unique experience. We do not know what a full year effect post-COVID is going to look like. I believe I will need a reserve to manage the consequences of a post-COVID year in terms of how that's going to manifest in terms of community need, but also the consequences of the significant backlogs that are present in the NHS that won't get picked up, but will have a direct effect on our budget. So I'm not just putting money aside for a rainy day. I genuinely feel 21, 22, 22, 23 are going to be bumpy. And that's a civil servant euphemism, if you haven't heard one before. The other thing to bear in mind is that the 1% carry forward that's going to be decided by full council, we have a plan with Councillor Bowkett, the portfolio holder, for how to make best use of that, investing it in new services that will help maintain people's independence, where otherwise greater cost over a longer term would apply. And that will also be coming here, Chair. Thank you.
Thank you, Glenn. Councillor Clark.
Thank you very much, Chair. I understand your ideas about reserve, but with some of this underspend, will any of it be allocated to prevention to help us deal with the long-term problem that's going to hit us over the next couple of years, as you said, with the COVID after effects?
Absolutely. There are a number of examples. Derek will touch on them when he comes to scrutiny and presents, but we've also managed to underwrite some of the costs in some of the more intensive care and support arrangements around drug and alcohol addiction, which otherwise would have reduced. We've also been able to bring in extra resources where we've had a known pressure point. Mental health is a case in point. What we need to do is make that into long-term investment proposals, which again would come back to the scrutiny committee.
Thank you. Well, if that's all the questions, Pam, unless you've anything else to say, thank you very much for joining us and for patiently waiting in between your sections. Thank you very much.
No problem. Thank you.
So we'll note the financial performance and the drivers of the financial position for item 8. And Glenn's going to leave us now. Is everybody happy to crack on to the end? I am, if that's okay with you. I think one or two have slipped out to the loo, perhaps. But we'll carry on then with item 9, proposals for scrutiny reviews. I think, Simon, you're going to lead this.
Yes, thank you, Chairman. This paper is in a format which is very similar to the papers which are being presented to all the scrutiny committees during July. It follows a request from the Overview and Scrutiny Management Board for the for all scrutiny committees to consider suggestions for items for in-depth scrutiny review, which would involve a review by either Scrutiny Panel A or Scrutiny Panel B over a period of 6 months or so, sort of an intensive and detailed piece of work. I would just draw the committee's attention to section 6 of the report, because that's the section that's referred to in the recommendations. And following discussions between the chairman and vice chairman and the executive director, there was a sort of a view that at this stage it wouldn't be appropriate for this committee to put forward any in-depth reviews. And in part, this is perhaps because there are a number of issues in terms of the national agenda which are not yet clear, and also more from a point of view of practicality, there's still a long way. There's still a number of new members of the committee who perhaps would feel that they would need more experience of the remit of this committee before items could be put forward. So that is that's essentially what section 6 of the report is saying. Thank you, Chairman.
Yes, thank you, Simon. As a new member myself, I felt that I needed a bit more time to sort of get my head around some of these things. Hence my comment at the very beginning about the training on the Care Act, which we're going to bring in for us. And it's not just for us new ones, it's for anybody to come to, because we all need a refresher, don't we? So that was my opinion, and I think Hugo and Glenn thought the same. Councillor Overton.
Thank you. I do take the point, but the other thing about being new is that you've just been talking to a lot of people in your area, and you've just been elected because you know your area. And I think it's absolutely the right time to be thinking about what topics you want to look at. And I understand the other thing I think we should probably take into account is not to put too much pressure on the department, because they're obviously doing a really good job and they've got plenty on their plate. But at the same time, there may be ways in which we can help without putting too much pressure. I mean, some of the items we've had today discussed, may well be things that we could just have a bit more of a look at without being overburdensome on anybody else. Thank you.
No, that's a good point, Councillor Overton. Councillor Carter.
Thank you, Chairman. I would be minded to quite agree with Councillor Overton that actually there's a lot of new people that actually have got quite a few ideas already possibly coming forwards. Obviously, it's not us that's going to be doing the deep dive. It would be the scrutiny panel A and B that would obviously do that. But I think there are even from today some things that may have come up. I personally would very much like a deep dive somewhere within the alcohol services, for example. I think it is incredibly topical. I think the increase of drinking has been huge since the pandemic, and I think the knock-on effect of our services and everything will be there. And if we can do anything to assist the improvement of those services, I would very much be in support of that, to be honest with you. So as a suggestion, that's one of mine.
Yes, thank you, Councillor Carter. I mean, as a funeral celebrant, I see it only too often. The thing that was in my mind, just personally, was the safeguarding issue, because that still seems to me, although Glenn did say that it's still in its infancy, safeguarding, I understand that, but there still seems to be a lot of confusion in various areas as to what safeguarding of adults is. And I think perhaps a more joined up approach with all the organisations and actually more training might be really helpful. But whether that's part of a scrutiny panel's job, I'm new to this, I don't know, but I just think there's that target seems a bit worrying to me, because obviously people are referring things perhaps that they shouldn't, but equally we don't want things to go under the radar, and vulnerable people, they're always vulnerable people, could be missed. The example that Glenn gave about the empty dog bowl, although it sounds as if it was just a dog not getting any water, it could have been, of course, the owner not looking after themselves either. So it's very difficult and it's complicated, but that would be my choice. But equally, I agree with Councillor Carter. Councillor Mrs. Clark.
Hi, yes, can I just add to that? One of the...
Can I just stop you? I think we've got a comment at the back. Councillor Matthews. We'll have them after Councillor.
Thank you very much. Moving on from that, one of the things that I picked up today was the lack of PIs around carers. The information isn't there. I know it's in its infancy, but the information isn't there. And because of the pandemic, we probably need to know a bit more about the age range of our carers, you know, particularly the very young ones, because we talked about social isolation. So they might have felt very isolated, unable to contact people, possibly in rural areas as well. So that's a key area for me that I would like to look at. Thank you.
Thank you. So we've got 3 areas already. We've got Councillor Colin Matthews would like to come in, who's online.
Yes, hello. Can I apologise for the background noise? I'm in a fairly noisy place. I absolutely get the idea of a deep dive into a single tranche, but I'm more concerned about the way all of the arms join up. And I think in doing a deep dive into one, we may miss the connectivity into others. So I don't know how you would go about that, but have we got a homogenous approach where there is equality of opportunity for engagement with all of those arms, rather than looking deeply at any one where we know we're probably going to find great strengths and great weaknesses, but it's how we have interconnectivity between us and partners across the whole of this provision that interests me.
Yes, thank you, Councillor Matthews. Does anyone else have any? Councillor Mrs. Overton.
Thank you. The other issue that has become very prevalent, of course, is mental health issues currently. And thinking of the carers one, just in support of that, I know a carer who has looking after an adult who's deaf, and of course, with no care place, you know, normally he would have gone off for 3 days to one of the day centres. But she was therefore looking after this individual 24 hours a day, 7 days a week. And they had to stay in because he was on a lock-in. You know, the mind boggles. So I think there has been huge impact on carers. So, I mean, I would support that. Maybe we should say that each of these would take 3 months and just do one at a time over the year. Thank you.
Thank you. Well, I think there's various things have been put forward. Maybe the suggestion was to look at it again in December or January. Probably we should say for the December one, by then the COVID situation should be a bit clearer. Things probably will have started to come back to normal, and we can perhaps decide then which one we're going to do first. That's what I would perhaps suggest. So rather than leave it till January, we go for December and then have a bit more of a firm plan. How about that? Councillor Overton.
Sorry, I think we should do that. I think it's really good. But can we agree that those are the 4 topics? Perhaps which one comes first, I don't mind. Maybe it's, we can take some professional opinion about which is urgent or which has got something we can really work on in order to make a difference. They can see something that there's a space we can push and support. So just to make sure that it doesn't disappear into the ether. But if we do agree that we'll definitely go ahead with those, that would be great.
Can I just ask about the scrutiny panels? How many things can we put forward, Simon?
Well, there is no limit to the number of items that can be put forward, but there are 2 scrutiny panels, and they are considering, Overview and Scrutiny Management Board will be considering suggestions from across the council for all of those panels. I am aware that other committees are about to or have already put items forward. So there is then a decision that has to be made by the Overview and Scrutiny Management Board as to which 2 are taken forward for a scrutiny review. That wouldn't necessarily mean that the others on the list are ruled out, provided the timing is okay. They could be picked up at the end of the 6-month period. But just in relation to the suggestions that have been made, I've logged those, and maybe we could reflect on those, Chairman, as you say, back in December in the report. But some of those items will be picked up in this committee's own work programme, which is the next item on the agenda. For example, mental health. There is an item which I think is lined up for the December 1st of December meeting. So there are a number of items that in the sort of autumn programme of this committee which will pick up some of the items that have been mentioned today. Not necessarily, it's not a full review, but it is an item on this committee's agenda. Thank you, Chair.
So maybe by December then we'll have a bit probably clearer idea which one we want to go for first, and then we'll put that forward hopefully in December to the overview management panel. Right, is everybody happy with Councillor
Chairman, can I just be enthusiastic for a minute, if you'll let me do that? Just to say that I think we have such a great opportunity here, and I really hope that, I'm sure all of our members will want to really get engaged and make a difference. The days when we just have a report and ask a few questions, that's one thing, but I really like the idea of actually thinking it through from our residents' point of view. How does it feel? Maybe asking different people in so we can get a picture of how it is, and then and in that way, as was mentioned with Councillor Matthews, working across the different spheres, because as soon as you ask somebody, they have a different world, haven't they? And you do start to see the strands. So I would really like to do a really good job on some of these issues. Thank you.
Yeah, I mean, the enthusiasm today amongst the committee is really good, I think. I mean, I've never been to anything like this before, but I'm very impressed by the fact that people have actually read the information, thought about it, and come up with some really interesting and useful pointers, hopefully, for the officers. Councillor Kendrick.
Thank you, Chairman. All I was going to say is, bearing in mind we have competing topics, that we could look again at the criteria that's been set down for judging this to make sure that the ones we pick are the most relevant in relation to the criteria. That might help us concentrate our minds, I don't know. But something we need to look at.
Yes, that could perhaps be something that the 4 of us look through against each of those 4 suggestions, Simon.
Yes, that's right. Thank you, Chairman.
We can do that at our next pre-meeting or whatever we have. Yeah. Let's crack on then, shall we, to the final item on the work programme. Page 87 to 92 of the agenda, and this is our work programme for this next year.
Thank you, Chairman. Following the committee's meeting at the end of June, the work programme has picked up most of those suggestions, and that is set out on pages 88 right the way through to page 90. So that picks up most of the suggestions that were made at the committee last time. I won't go through each item in detail, but it is now for the September, October and December meetings, there are 3 to 4 items listed in each case. Thank you, Chairman.
Is that normal at the moment for this stage, Simon?
I think typically in the past this committee has worked with 3, 4, maybe 5 items on each agenda. Obviously, certain items take longer or are more complex, but that would perhaps be the aim. This wouldn't necessarily preclude other items being brought forward, and it could be that if there are any national policy developments in the next few months, it might be that the Executive Director would want to bring a report on those items, say, to the September or October meetings or whatever.
I mean, Derek Ward is on the September agenda, and when we had our induction, sadly, his contribution was cut really short because we didn't have much time left. So I'd imagine we want to give him as much time as is needed, and I imagine he'll have lots of questions to answer. So I imagine that's quite a big thing, Simon, on the agenda for September.
Yes, thank you, Chairman. The item 2, which is perhaps not very catchily titled "Role of Director of Public Health and Service Areas," is really to pick up those items that are not in Derek Ward's remit, that are not covered by the first item on that September agenda, which is the overview of prevention items. But I think that particular meeting would cover provide an overview of most of the areas under the Director of Public Health.
I think with the COVID situation, I imagine he'll have lots of things to talk about, and we'll have lots of things to ask him. So are we happy for the time being that the September items really should stand? There may be other things added in the meantime, of course. So, Councillor Clark.
Yeah, I was wondering, we discussed those 4 possible items that would go to the scrutiny panel. Is there any way that we could review those in one of our future meetings rather than leaving it all the way to December? I'm conscious of time, and being a new person, maybe I'm rushing things a bit. Maybe I need to settle into this a bit more, but I just thought that, you know, if we've got time, could we maybe discuss one of those items and throw forward a few ideas for the panel to investigate?
We can certainly do that. Perhaps for the September work programme report, there could be some more detail on what a review of each of those 4 items could cover, if you like, a short appraisal.
Yeah, that's if we add the scrutiny panel issue to the September agenda, then with a bit more information on each of those 4 items, and then we'll be ready then, hopefully by December, to put something forward, won't we? Is that acceptable, Councillor? Yeah, lovely.
Yes, that would be very a good idea as far as I'm concerned. Thank you.
Thank you very much. Well, I think if that's everything for now, Simon, is there anything else that we need to do that I've forgotten?
No, Chairman. That is the agenda all covered. Thank you.
Thank you. Well, if I could just thank the people online, because I imagine they're still there somewhere. It's really, you don't know whether they're there or not, do you? But thank you for bearing with us, and I hope everyone's found this meeting useful. I certainly have. It was a bit of a baptism by fire for me, but I have enjoyed the meeting, and there's been some really important and serious matters discussed. So thank you all very much for your contribution, either here in the council chamber or from home or your office, wherever you are today. Thank you.